Hello. Hello, everyone. Our topic for today is an exciting new tool for monitoring child development across the entire state of Israel. I'm Bruce Rosen for Israel Healthcare Highlights, and my special guest today is Yair Sadaka from Ben-Gurion University, the Ministry of Health, and the Myers JDC Brookdale Institute. Welcome, Yair.
Thank you very much for having me, Bruce.
Terrific, terrific. So, we'll get us started by telling us a bit about yourself and maybe your background.
Sure. So my name is Yair Sadaka, as you've said. I'm a pediatric neurologist, and I'm also the head of a child development center in the southern part of Israel, in the Negev, that belongs to the Ministry of Health. On top of that, I'm a researcher in Ben-Gurion University, in MJB, and in KI Research Institute.
Terrific, terrific. So, what drew you to want to look at child development, and why do you think this is a topic that should interest many of us?
Well, I'm a pediatrician, so I'm kind of focused in kids. But on top of that, I believe that it is very interesting, since if you think about it, the child's brain is quite plastic in the first few years of life. So in the first 2 years of life, our brain will increase to the 80% of the size of the adult brain. After 5 years, we will reach 95% of the size of the adult brain. So it means that the majority of increase in the child's size will happen in the first few years of life.
I
It is
understand
not,
at birth, it's what, 50%?
yes, something like that.
Okay.
And it means if you think about it, it's not just the size, it is also the connections, the synapse that will be enriched in this dynamic part of our life. But it is not only the size and it is not only the synapse, it is also something that occupies us, the family. So any parents are kind of occupied with their child development. So are quite kind of focused in these particular moments of life. And if you look in terms of economics, every dollar that you will invest in this particular time in life will be $7 later on, because this is a kind of a cardinal time frame in your life. Yeah.
Okay, I guess it's also in some ways at the intersection between medicine and education and psychology. Can you share some reflections on that?
Yeah, it is, when you are working in a child development center, it is not only being a kind of a child development specialist in terms of medical skills. The children you meet, the parents you meet, and the team that is working with these families is multidisciplinary team. So you have educators, you have a psychologist, you have many, you have a kind of a very large team that is being focused on the child's development.
That's great. Look, this is a topic of interest around the world. Is there anything special about Israel that can be useful to us as well as to other countries?
Yeah, I'll start by that I think that Israel is kind of a very interesting place, since we are a multicultural nation. If you think about it, we have Jewish, we have Muslims, we have Christians, all are living here together. On top of that, Israel is quite young nation, and our kind of in previous generations have been coming from Europe, from United States, from everywhere. So we are kind of in an intersection of many different multicultural societies within Israel. So whatever you find in Israel may kind of reflects the other parts of the world. On top of that, I think that Israel is quite unique because we have a very strong central government services. And it is specifically kind of, how would I say, focus on medical services. And we have very strong medical services in Israel that are being given to the entire population of Israel. And it doesn't matter what part of the population, whether you are rich or poor, you will receive quite decent medical services. On top of that, maybe I'll focus later on maternal child clinics, which are kind of a unique clinics that we have here in Israel that serves the entire population of Israel. All kids in Israel are entitled to these clinics that happen from birth to 5 years of age. And we see almost 89% and 98% of the children in Israel in these clinics, and which is kind of interesting. And on top of that, we are a startup nation. So it means that we have a digital data regarding the entire population of Israel in this, when we give medical services, which is quite unique from the previous millennium. So I think that it gives you an opportunity to study this child development in unique tools, with unique tools.
Terrific, terrific. So that's really good background. Now let's focus in on this new tool that you started telling me about before. What is it? What's it good for?
So I'm going to discuss, so let's once again focus on the maternal child clinics. And I would like to share with you the maternal child clinics so you'll understand what is happening with these clinics. So let me just share it. Yes, and let's make it in a presentation one. So this is the maternal child clinics that we have in Israel. And in the maternal child clinic, we give many different services. We collect a lot of information regarding the kids that are coming to this clinic. So it will be with such a demographic data, pregnancy, delivery, blood counts, EDPS, which means maternal depression post-birth. And we also monitor quite specifically growth and development. And in terms of development, we collect data regarding fine motor, gross motor, social and language skills. And on top of that, we are looking on the parental concern regarding the child development. So this is a lot of data that is being collected, these data sets for the entire population of Israel. So
that's terrific. How many years back do you have this data for the broad population?
So we have it, we have it for the last 20 years, but it is quite precise from 2014. So from 2014,
that's amazing. I don't know of any other countries that have that. That's amazing. So give us just a couple of the examples of how you're using this data, and then we're going to have to wrap up.
Okay, so if you think about it, each child that will come to this maternal child clinic will be examined for developmental milestones. And we collect many different developmental milestones according to the child's age. So if you ask about numbers, if I'll take just 5 years from these data sets, I can look at almost 1 million children with almost 5 million developmental assessments regarding the different milestones. And for each milestones, if I'm kind of evaluating milestones, I can see how many children succeed in each and every milestones in different time frames. So I'll go through this slide. So if I'll see whether a child grasps an object. So if I'll see all the kids that are coming to the clinics when they are 3 months of age, I will see over here. So I see that more or less 65% of the children are able are succeeding this milestone. If they will come when they are 4 months of age, it is more or less 90% that will succeed with this milestone. And if they will come when they are 5 months of age, it will be more or less 95% that will succeed in this milestone. So it means this is only for one milestone. But if I will take the entire 60 milestones that I'm evaluating in the maternal child clinics, then I'll be able to create this scale, and we call it this scale, Tipat Chalav, Israeli Surveillance Scale, which shows us, this is a very good tool for surveillance, since I can see when a child should do specific milestones, and you can look through the different ages of each child and see what milestone he should already do.
So if I understand this correctly, this is helpful both in identifying individual children who require more attention, but also population groups, whether it's the Bedouin group or people living near a factory in Haifa, right? Is that correct?
Very good, Bruce. I completely agree, because you can use it individually. So when I'm evaluating a kid that come to the maternal child clinic, I can use this scale and now be more precise with what is a delay in a specific milestone and what is not a delay with a specific milestone. And on top of that, I can go through population and do what we call a national developmental report for each and every kind of group. of population in Israel, in different kind of cities in Israel, and to see what are the strengths and what are the challenges for each specific population within Israel completely.
Well, this was really good. I'd like you to join us again, maybe a year from now, with some of the results from this national surveillance. Where are the problem areas? Which skills and which population groups and which regions? But for now, already, this is already very exciting. Yair, thank you so much for joining us here today.
Bruce, thank you very much for having me once again, and thank you.